So here we are. This is our State Technical Assistance webinar, which we call STAW. And this is sponsored by the Child Safety Learning Collaborative, or CSLC. And why don't we go to the next slide so we can say a little bit more about that. Um, Children's Safety Network. We're here. We're a national project advancing the field of injury and violence prevention for children and adolescents. Um, these are the four kind of main pieces of what we do. We develop webinars and resources. We um uh what's the word? Sorry, I just lost it. We broker kind of national partnerships through our Children's Safety Now Alliance, or CSNA. We offer training and technical assistance, and a big piece of what we do is the Child Safety Learning Collaborative. Many, but not all, of the folks on this call are part of the CSLC. It's something that we do every other month, mostly for the states that are participating, but we are opening it up to anybody. So if you are participating today and you're not part of one of our CSLC states and you'd like to learn more, you can go to csn.org and learn more about the Child Safety Learning Collaborative. We're actually starting a new cohort in November, and there's still time to apply if you're interested in being part of it. And you can learn more by looking at our website. But we're taking applications through the end of the month. Thanks, Jenny. Jenny just put the link to this to CSN in the chat. So you can go there and you can learn more about us and what we do and about the Child Safety Learning Collaborative and what that might offer. So next slide, please. CSN is supported by HRSA, the Health Resources and Services Administration of the U.S. Department of Health and Human Services, of the government and of the U.S. Federal government. And as we always say when we have an event, the information and content that we have here comes from us, it's of the author, and should not be construed as the official position of or policy of the HRSA, HHS, or the U.S. government. So next slide, please. So here's just some details about engagement today. Please feel free to use the chat feature and ask questions and make comments whenever you want. You can stay muted when you're not speaking, but we hope that you will speak up later and participate, ask questions, participate in a conversation. And when you do, you're welcome to, at any point, you're welcome to get on camera. We were happy to see your face if you are able to share your video. You can click the CC button to look at closed captions. This, as most of you know, because you were here at the beginning, this session is being recorded and posted. And as we asked before, we've asked people to rename yourself with your state abbreviation so that we know who everybody is and where you're from. So next slide, please. These are just our guidelines, our community guidelines. We ask people to be present and be curious, be partners in learning. Our motto for the CSLC is all teach, all learn, and we hope that we're modeling that in these webinars, and take care of yourself as needed. So also, we always want to know who's in the room. And so just very quickly, Caitlin is going to launch a really brief poll. So if you wouldn't mind, just take a second and click on what your role is. We just want to know who's in the room, and then we'll be able to kind of move on to our next topic, the next part of this webinar. So I see a lot of people are voting. You just click on one. We're going to wait and see if we can get a few more people to vote before we end this. Let's see if we can get up to more than half. So again, please take a look. Just click on what your role is. And there's a lot of possibilities here. You can actually scroll down until you find yourself, or you can be other. So we'll just give people like another 10, 15 seconds. I see that we've got, let's see. Oh, we've got a lot of people with government agencies and other nonprofits. Okay, that's great. Thank you. All right, why don't we end the poll, and then why don't we go on to the next slide? So this is our agenda for today. First, we're gonna, after the welcome and introductions, which is what we just did, we're gonna talk a little bit about just some general background on what is a 90-day AIM process. What do we mean by that? We're gonna have a general description and then an example of how it could work for a particular change that somebody wants to make in their life. We're going to talk about aligning your aims with your state's Title V action plan, including having somebody come and talk about how they've done that with their 90-day plan and how it's worked for them. So that'll be our example. We'll have a discussion and then we'll talk about next steps. And again, please feel free to type into the chat if you have any questions or comments. We will call on you when there's a break, and you're always welcome to unmute yourself and show your video and talk to the group then. And I'm going to turn it over now to Jenny for the next part.
I'm going to turn it right over to Maria.
Oh, sorry.
No
I'm supposed to turn it
problem.
over to Maria. Okay.
Welcome, everyone. Thank you so much for joining us today. I see some familiar names and faces and some new faces. So thank you for taking the time out of your busy schedules to join us. So today we're talking about managing your child safety work through long and short-term goals. So I'll give you a bit of a background, and then we'll have some awesome examples coming up. If we can go to the next slide, please. So this slide, for those of you who have joined us on webinars or previous STAWs, you may be more familiar with this. This is the CSN framework for quality improvement and innovation in child safety. And we have a couple of things. So we'll start from the left side of the screen with our inputs. And so this little pie is what we in this Child Safety Learning Collaborative help state jurisdiction teams strengthen these three components. So we focus on child safety expertise, leadership and management, and systems improvement. And we hope that the teams will experience the outputs that we have in the middle. So these improvements to workforce development and developing their child safety system. And we hope that the ultimate outcome is the effective state jurisdiction teams will increase their child safety. They'll experience some positive health impact. Underpinning all of this, of course, is addressing health disparities. So in the next slide, I'll give you a bit more information. Oops, we lost the slides for a second. Okay, thank you. So we're popping these in. Great. So in our next slide, we have the model for improvement. So this is really the basis for a lot of the work that we do. And we want to start off with our overarching aim. So what are we trying to accomplish? And we would hope that you have looked at your state data, or even your local data, and you're finding something that you'd like to accomplish. And then we'll go into measures. How will we know that a change is an improvement, and your change ideas? What change can we make that will result in an improvement? And we do this doing lots of plan, do, study, act cycles, and really trying to put these words into action. Next, please. So, this is sort of the approach that we take. You've established a team, whether it's your internal team or a strategy team for the Child Safety Learning Collaborative. You're determining your overarching SMART aim using your outcome level data. So you've already reviewed your data. You're really trying to focus in on what's going to happen in the long term and in the short term. You've selected strategies and measures that will help you change something and also measure that change over time. You've identified your data sources. And then you're looking at SMART goals and you're operationalizing your strategies or change ideas and using data. So for the purpose of the rest of our chat with you all today, we'll be talking about the 90-day aims. So this is really a way for us to break down those overarching aims into more bite-sized, digestible pieces. You don't want to really focus all of your attention to the overarching aim because that might be a long-term. It might be over a 5-year process. It might be something that you've identified. You want to really think through a specific things that you can achieve in the next 90 days. So let's go to the next slide. And I can't see the chat while I'm presenting. So Lauren or Jenny, if you're able to share out anything that's happening in the chat, please feel free to jump in. What are the benefits of an aim statement? You want to make sure that you have your direction. Where's my due north? What are we trying to come up with here? What are we trying to accomplish? And then making sure that you have consensus. So if you have your partners at the table with you, whether it's your internal team or any other departments and organizations that are helping you do this work, you want to come to a consensus of where you're all going. And you want to create vision and alignment and commitment, of course, of all of these partners. We want to make sure that the aim statement is easy to communicate both internally and externally. We want to make sure that folks understand what's going on and how you're approaching the issue. Of course, you've already reviewed all of your data by this point, so you have enough justification to be able to communicate this clearly and effectively to others. And then you want to also think about the magnitude of the change expected and how disruptive is this likely to be. And that's some of the work that you can do in those next 90 days. 90 days. Next slide, please.
Oh, before you go on, there was
Oh,
a great
sure.
comment in the chat, which
Go
is a
ahead.
really great example of how this kind of planning process can be used. Joanne, who just posted that she's retiring in 8.5 days, she noted that in preparation for her retirement, she made a 3-month, 1 year, 3-year, and 5-year work plan to show what she needed to finish before she goes and what the person who's hired after her needs to attend to after they're hired. With pages
Wonderful.
listing key contacts and important meetings, it's a succession and a work plan all in one. I just thought that was such a fabulous example of what we're talking about that I just wanted to read that out. So Joanne, thanks so much for sharing that.
That's excellent, Joanne. Thank you so much. And thank you for doing that for your team also. Like how amazing is that? Great. So we'll go on to focusing our work. Great. So thank you so much. So we want to determine our overarching aim. So what are we trying to accomplish? We want to be specific and be smart by setting numeric goals. And we want to look at the larger set of strategic initiatives, perhaps even at the department or even at the state level, to determine how this specific injury prevention work fits into that larger initiative to create the synergy. And we want to determine our SMART goal. So what is the first step in the process towards this aim? Next slide, please. Great. So in determining our SMART goals, we have our 90-day aims and short-term goals. We have our SMART goals and the overarching aims. So these are the very short-term, the medium term, and the long-term aims that you have for your programs. So we want to break the aim into discrete action-oriented goals. What do you intend to improve by when, how much improvement, for whom, who does this benefit? Does it focus on a specific location, a type of program or population? And things that are achievable in that shorter time frame. So we want to really hone in on what is your 90-day aim and your short-term goals versus your medium-term and your long-term goals. And all of these can be smart. And so it's really important for us to keep this in mind. Next slide, please. Great. So here's a chart that we've developed over the years, and we really like including it because we think that this really illustrates the data-informed decision making. So you have this overarching aim. Maybe you looked at your state action plans. Maybe you looked at some larger statewide data set. You're working with other state departments. Be it the Department of Education, Department of Transportation, you've developed this overarching aim. You made a SMART goal about it. Then you've created your 90-day aim. So where this is that digestible piece of like, what can we accomplish in the next 3 months? And then you break it down into your PDSAs. All of the learning that you get from your PDSAs, from your plan, do, study, act cycles, will trickle back. They'll float back up into your adjusting your SMART goals, looking at your next 90-day aims and then your next PDSAs. So at the in order to get to your SMART goal, you may have multiple 90-day aims, and so that's what we're trying to illustrate here with the three cycles that are happening. You may have multiple 90-day aims, depending on which aspects of your program you're looking at. And you may have multiple PDSAs happening at the same time as well. So all of this learning, the data that you get from your PDSAs will inform your 90-day aims, will inform your SMART goal and your overarching aim, and that goes down as well. So from your overarching aim down all the way to your PDSAs, all of this information is related, and we need to keep that in mind to make sure that we're staying on track with our overarching aims. Next slide, please. So how do we determine our 90-day aims? We want to look closely at the SMART goal and the selected strategies and scan the current environments. What do you need to get this project up and running if you're in the develop and test phase, those early phases of improvement? And what do you need to do next to implement and change this change idea or strategy? We want you to consider what would be a feasible goal for this strategy. What would be a feasible 90-day aim for this SMART goal? What short-term goals will get you to your 90-day aim? What actions will get you to your short-term goals, and who will be responsible for them? And how will you measure your progress? And we want to make sure that we're measuring progress and not just measuring for the purpose of measuring. What measures are actually going to demonstrate that progress? And what are you doing to actually trigger progress to happen? And we want to make sure that you're planning how to share your learning with your team and partners. So how will you integrate what you've learned into your next 90-day aim over time? So with that, if Lauren, do we have any other comments or questions in the chat that we can
Nope, nothing else right now.
Nothing else right now. Great. Thank you so much for checking. So with this, I'll pass back over to Jenny to take us through a 90-day aim example. Thanks, everyone.
Fantastic. Thank you so much. All right, so before I get into an example, I would love to just do a quick hand-raising poll. How many of you use something like a 90-day aim or the 90-day aim yourself in your work? Just use the hand raise option to indicate if you already do this kind of breaking things down. Okay, Melissa, that's good because you're presenting. All right, well, that looks like this is pretty new information for folks. So excellent. Well, thank you for doing that. I wanted to just walk through a 90-day aim sample or example, and this is not an example pulling from the type of work you're doing. This is just an example to try and make it a little bit more tangible, because sometimes when we get deep into our work, using these kinds of tools, especially in public health, where we're giving these monumental goals and targets that we're supposed to be achieving, and we're told to do it all at once and to throw it out across the state, et cetera. And it can feel really, really overwhelming. The idea behind the 90-day aim is to really give you an opportunity to break that monumental task down into more digestible, tangible components that are all fitting together to get you towards that larger task or target that you have on hand. So I wanted to just give something that was maybe a little more personally relatable to everybody universally. So I'm just going to put it out there. I'm not a runner, but if I had to run a marathon, I would need to break it down into many 90-day aims, because it's going to take me a long time to get to running a marathon. So as you can see here, I am setting my overarching aim that by June 2030, I'm going to improve my overall health by increasing my strength and endurance by 10%, reducing my body mass index by 5%, reducing my sleep, or improving my sleep rather, by 5%, and enhancing my mental well-being through daily meditation. So I am looking at becoming a better person by June 2030. And I'm realizing that it's going to take me a lot of work. to get there and to really transform my state of well-being. But I've given myself very smart goals within this so that I can measure and determine over the course of the next 3.5 years if I'm really getting there. And then within that overarching aim, I want to run a marathon. So by June 2027, I'm going to successfully complete my first full marathon. And I'm going to do this by following a structured training plan that incorporates consistently running 4 to 5 days per week, incorporates strength training twice per week, and completes all key training milestones while remaining injury-free. So again, I have taken this overarching well-being, improving my overall health, and broken it down to within that, I'm going to do this. I can also create goals around other pieces of that journey towards my overarching aim, but we're going to just focus on this today. So now I'm going to go a little further down the funnel. And in the next 90 days, I'm going to establish an endurance, consistency, and healthy training habits that are necessary in order to begin my marathon training plan. And I'm going to do this by running 4 days a week, completing a 10 to 12 mile run, and finishing a 10K race or equivalent while maintaining a regular strength and recovery routine. So again, this is in my first 90 days. I'm setting some very lofty goals for myself. And I would advise that you come into this kind of an example with some basis of health already. Do not start having never done any kind of athletic training before. So that aside, now I'm going to break it down because to set that 90 days is still a lot. Like for me to sit there and think of, oh my gosh, how am I going to do that? How am I going to get to a 10K race in 90 days? I really need to drill down even more to start to get to a granular level to help me to really set out a steadfast plan and to ensure that I'm going to get to my success. So here again, just for the ease and simplicity of it, I am only focusing on one change idea or strategy. But realistically, my 90-day aim would probably have multiple change ideas / strategies that I'm employing in order to achieve this overall short-term goal that I've set for myself. But to again, for the sake of the example, we're just going to focus on my running. So as you can see here, I've used a worksheet that we'll be sharing with you all today. And it's helped me to break down my process. So here it is. My change idea or strategy is I'm going to run consistently and increase my frequency and distance. So I'm going to be measuring the number of days I've completed running. And I need to be clear with myself, what does that mean that I completed running? It's not just putting on my shoes, but I actually got out there and I achieved what I did, even if it means that I have to walk some of it, but that'll be part of my data that will inform my progress. How far did I run? And how many strength sessions did I do? Because that's part of me building up my endurance. So I set my short-term goal that in this first 30 days, my aim is to increase my endurance by maintaining 4 weekly runs, completing my strength training twice a week, and increasing my long run to get up to 9 to 10 miles, developing my effective fueling and recovering habits. And my short-term goal to do that is that by the, I'm sorry, I'm reading the wrong one. You can all see the right one there. I'm looking ahead at my notes, that I'm establishing a consistent training routine. And I am completing 2 strength training every week, and I'm increasing my long run to 6 miles while remaining injury-free in my first 30 days. So again, my short-term goal is that I will have completed a total of 16 days of running with 20 miles overall in 1 week and 5 miles in a single run. So again, I've given myself very measurable, very tangible things that I can focus on to help me to really implement this. So I'm going to run some PDSAs. I'm going to figure out what is the appropriate equipment that I need. I'm going to draft a workout calendar and see how that works to keep me on track so that I can get up to 4 days a week, that I can increase my strength sessions to 2 days a week, and I'm going to track my daily distance so that I have data and I can see how I do, expecting that I'm going to increase my distance in this month from 1.5 miles to 5 miles. And then, I set out who's responsible. Well, this is just me. But again, in a more comprehensive strategy, you would have a team. You would be using this worksheet to determine who's responsible. It could be people within your team. It could be partners in the community and so forth. And then you set due dates, and this can really help to drive your work. So jumping ahead to the next 30 days. So at my next 30 days, I have set my next aim and said that, as I said, I was going to increase now so that I'm increasing everything and getting up to 9 to 10 miles. And that by the end of this 30 days, I'm going to improve my pace as well as achieve the 10-mile distance in a single run. And I list out what my PDSAs are that I'm going to do in order to get there, to test this and to see how I do. And so in the course of this, I am going to be using data over the course of each of these 30-day periods within the 90-day to help adjust. So I'm going to have learned from that first 30 days to say, okay, well, I actually didn't do a great job running 4 days. So that's going to be, staying on track with 4 days, maybe trying to run, a little bit more, or do 5 days one week and 3 days another week and so forth. I really have to use that data to continuously tweak things as I move forward, but that helps to inform what I'm doing. Okay, I don't know what just happened there. And then I get to my last 30 days. And again, I set out my aim, my short-term goal, and the data that I'm tracking and how I'm testing this. And in the end, I get to the end of that 90 days, and then I reassess. How am I doing and working towards that short-term goal of by June 2027, I'm going to be able to run a marathon. At this point, I'm hoping that I've completed a 10 to 12 mile run, that I'm running a 10K race, but that's a long ways from a marathon. So this is just the setting foundation to set up for my next 90-day aim, where I'm going to use this experience and information to establish next periodic goals and implement the new strategies that are going to help to continue to get me to that entire overall arching game. And I think now I hand it back to Maria. Or maybe it's
Actually, this time you're handing it to me. Thanks, Jenny. Thank you. I hope that was helpful in terms of kind of breaking down what we mean by really using the 90-day aim process in anything that you're doing, using that kind of step-by-step planning process. So we're going to circle back to the kind of work that we're doing now. And we'll get back to kind of the actual 90-day aim model in a moment. But first, I just wanted to note that all recipients of Title V maternal and child health block grants develop a state action plan. And this includes a five-year objectives in each of the domains. And some of the states participating in the CSLC have made a real effort to connect the goals that they're working on as part of this collaborative to their state action plans. So I'd like to share an example from one of the states that's in the CSLC right now and how they did this. So next slide, please. Oh, thank you. And Caitlin just put the table. So if you're wondering what your state action plan is, what it looks like, you can click right on the link that's in the chat and you can find your state there. So Indiana has been part of this cohort for bullying prevention, and they'll be with us into the next cohort. And as you can see, in the domain of adolescent health in their state action plan, one of their objectives is to improve local middle schools' capacity to prevent bullying. So the second half, the right side of the screen, is from our operationalizing form. And those of you who are in the CSLC should be familiar with this. It's a tool that we have to help states connect what they want to accomplish with the evidence-informed change ideas from our change package, and can connect them up with strategies that are concrete and with measures. So you can see here that Indiana directly connected their aim statement with their state action plan. Specifically, they're launching a pilot program, the Indiana Youth Upstander Program, in 6 middle schools in the Indianapolis area, to support them with the implementation or scaling up of a bullying prevention initiative. And actually, the reason they're not here today is because apparently they have a meeting today that conflicts with this one with the schools that they're working with in Indianapolis, getting ready for the new school year. So I don't know if anybody has any questions about that, but I thought this was a nice example of that kind of alignment that we're talking about. So please, if you have any questions or comments about this, please feel free to put them in the chat. Why don't we go to the next slide? And then we'll take a look at a blank version of the worksheet that Jenny used in the example. So basically, once you have your overarching aim statement for what you want to accomplish, you would put that at the top here. And then you select change ideas or strategies They'll think about how they're going to be measured, and then you can focus how to break this down into short-term achievable goals. Um, just like Jenny did with the marathon running. So if the aim here is, for example, to implement in the Indiana case, to implement the Indiana Youth Upstander program, a short-term goal might be to provide schools with a list of evidence-based strategies to choose from. So then that can be broken down into a PDSA cycle, like Maria mentioned, where you plan, do, study, act, or you can also just, in any case, it's important to just list out your action steps, figure out who's responsible for each one, set a timeline, and then document your progress. So that's basically how this works. This is exactly what Jenny was describing in her example. And I just wanted to check and see if anyone has any questions about this. And then we're going to move on to a great example that we have here today. Um, any comments, any questions? Well, now I'm going to introduce one of our somebody from one of the states that we're working with. So one team that has been doing this regularly. So you can go on to the next slide. And with great success is the Tennessee Suicide and Self-Harm Prevention Team. So as we were preparing for this webinar, I learned that this team there, that they're big fans of the 90-day AIM process. So I reached out to Melissa Munoz from Tennessee to tell you about their process and how it's supporting the work that they do. So I hope that you can spotlight Melissa as well, so you can see both of us. Thank you. And Melissa, it would be great if you could introduce yourself, just say what your role is in Tennessee with your Department of Health, and then we can talk a little bit more about what you've been doing with this 90-day AIM process.
All righty. Thanks, Lauren. Hi, everyone. Good afternoon. My name is Melissa Munoz. I am the Behavioral Health Programs Director for the Tennessee Department of Health. So I do oversee all of our suicide prevention work. And yes, as Lauren said, we are huge fans of the 90-day plan. It really has helped us, specifically with our implementation of the Sources of Strength initiative in Tennessee. So yeah, happy to share and kind of go through what our process has looked like.
Thank you. So you can go on to the next slide, which is their 30-day plan. So I see maybe you could read through the change idea and the measures that you picked, and then talk a little bit about like how you picked a short-term goal here.
Mhm. Yes, so our first 90-day plan, it spanned from March to the end of May of this year. So for the first 90 days, what we did was, first of all, starting with the change package, we had like as I said, we selected sources of strength as our primary thing that we're working on for this collaborative. And then we selected the two change measures. So it's the number of children or adolescents receiving education, and then the number of sites where the program is being implemented. So for the goal, we said for those first 90 days, by May 31st of 2026, we were already implementing sources of strength. So it was our goal to continue to provide the training to the schools that were already implementing, as well as recruiting 3 new Tennessee schools. So we kind of broke that into 3 kind of major steps there. So the first one was just to really have one of our partners, the Tennessee Suicide Prevention Network, continue with just kind of spreading the word and making organizations aware of this opportunity. So they were responsible for providing informational sessions to middle schools and high schools and community and faith-based organizations. So we put a due date on it. And then one thing I do want to highlight about our plan, that even as I've been looking at it now, like this is very much a living document. So like even as I'm looking at, our progress towards goals and some of the other activities, I'm like, oh, okay, I'm making a mental note. I have to go back and make some updates and kind of update, where we are now as opposed to when we first made this plan. So really just the way that we use this table is just to keep us really on track with our goals, and kind of what we want to make sure that we are accomplishing in terms of keeping us, continuing to implement the program and also expand it and adjust to any kind of changes that come. So, yeah.
That's great. So it sounds like you've been using it all along as a process. And then, so then what happened next? So why don't you go to the next slide? how did you look back on how those first 30 days went? And then how
Mhm.
did this inform your 60-day plan?
Yes. So for this next kind of chunk of time, something that was really helpful about this template for us or this tool is that we are actually, it was during this second period of kind of June through August, which we're currently in now, that we are kind of going through a transition in how we are implementing on our strategy for how we are going to be continuing sources of strength. So previously, we had an external partner who was responsible for most of the training or all of the training, recruitment, and data collection for sources of strength. But we will actually be kind of shifting our approach and bringing more of the work internal to the Department of Health as well as partnering with some other key partners who have relationships already with the school system. So, kind of relying more on our partners at the Department of Mental Health and at the Department of Education as well. So, this tool was really helpful for thinking through that transition and kind of making sure that we have everything in place to kind of facilitate that while continuing to maintain the program in place. Um, so as you'll see for the first part, like we wanted to still make sure that we were supporting our external partner in continuing to train and meet their deliverable goals for their contract. So making sure that they still had everything they needed to be able to recruit those two additional schools and make sure that licenses for sources of strength were in place through the end of the last school year. And then we kind of shifted our approach for those um, next couple months to really think through, okay, how are we going to, what are the steps that we need to put in place for the future of this program? So that included collaborating with TSPN to make sure that we had all the right contact information for all of the schools that we're implementing, since since we're going to be shifting kind of management of it more internally, as well as building capacity from, not only the Department of Health staff, but also all of our partners who will be now facilitating the training. So we decided to host a train the trainer for the individuals that will be now responsible primarily for implementing the training. So really this really helped us break down kind of the big task of saying, okay, we're going to switch how we implement the program, but we don't want there to be any interruption in the actual delivery of the program. So that this template really helped us kind of break down that big task into smaller, like bite-sized activities that we can say, okay, let's, make sure that we don't miss anything, and just kind of make sure that we have all of the activities in place. So I would say this period two was really kind of our transition
Mm.
period and kind of making sure we have everything in place for that.
Okay, that's great. And I like how you were really able to use this tool to kind of track different strands simultaneously, right? So like
Hmm.
if this is what's happening, this is what we need to do to make this transition, and then we still need to be doing training now to prepare for the next thing. So
Right.
you were
Hmm.
able to kind of on different lines kind of track all that and keep it straight. So I think that that's a really good example of using the tool. So then what's in your 90-day aims? In your next,
Hmm.
when do we go to the next slide?
Yes, so this next one is the period that's going to start in September. So we've already started planning kind of what the next iteration of the implementation of the program will look like. So our goal for that next 90-day period is to just really make sure that we can, kind of continue the program with fidelity as while we are, kind of going through this leadership transition. So we want to make sure that we are supporting the sustainability of the program in the schools that have already been trained. So we'll be doing that by one, working with the Department of Mental Health and the Sources of Strength national team to establish a training schedule for the fall. So we want to make sure that the schools that need to be trained and are due for their annual licenses will not kind of fall off the radar with this transition. We want to make sure that they're all getting the training they need with this new set of trainers. Something that I didn't include on this, which again, it's a living document, something that we did was I met with the Department of Mental Health staff who will be acting as the trainers to kind of assign to go through the list of schools that will need training and assign which trainer will be assigned to which school according to some of the connections that they already have or the counties they already serve in. So that was another kind of a sub goal or sub activity that we had as part of this, just to make sure that we have everything in place. And then I do have a meeting with the national team to just kind of work out the details of that schedule to make sure that all of the schools that need to be trained receive their training. In terms of the licenses for this upcoming or the school year that has already started here in Tennessee, our contract with Sources of Strength will go into effect September 1st. So at that point, we will be able to renew the licenses for all of the implementing schools. And then what we want to do during this 90-day period as well is identify some of the schools that we will be adding to our program as well. So working with the trainers, working with our partners at the Department of Education, and looking at data on, where the kind of the highest need is among adolescents. We're going to be working on identifying some of the schools that will hopefully be recruited to implement the program during the spring. So that'll be kind of looking forward to our like next 90-day plan after the one that ends in November will be okay. Once we hopefully during this time identify some of those new schools, what can we do to recruit them, get get them on board, and then hopefully schedule their training and have them implement. So yeah.
So thank you for all that. I just wanted to point out that I think this is a flexible enough tool that you can kind of use it in different ways. Because I see that what Melissa and her team did here is they had a shorter term, a 30-day one. They followed that by a 60-day plan and they followed that by a 90-day plan. Whereas I think Jenny's example was actually over 90 days what was happening during each 30-day period. I think this
Hmm.
tool is flexible enough to use it in whichever way works best for you. I think this is the way that worked best for your team, Melissa. And I think when you were talking about the pieces that were not quite part of this 90-day plan, I could see if you really wanted to continue breaking it down to say, well, now we're looking at the 30 days between September 1st and September 30th. And just in those 30 days, we have to do A, B, and C. And those are like the more granular details that you were talking about around
Hmm.
licensing or around, whatever they were. So I think that there's a lot of different ways you can use this. It can be a little bit more big picture and like, these are the big things we're accomplishing over 90 days, or you can break it down even further. So I think this was a good illustration of like basically it's a tool that you can use in whatever way fits and like suits the work that you're doing and supports you the most. And I'm really glad to hear that this has supported you. Are there any lessons learned from this? Is there anything that having used this as one of your tools for work that you're like, oh, this really helped me to realize this, or if we hadn't used this tool, we might have forgotten some piece or anything like that?
Well, I think this tool really helps us to make sure that we're being kind of realistic with our goals and like with, again, thinking through like our SMART goals. And I think having specific time periods, that we're focusing on is like it really forces us to sit down and say, okay, what can we realistically accomplish during this 90-day period, and who do we need to get involved as well? So I really love that it has the responsible party as
Hmm.
well, because I think kind of even just like what I tend to do is say, okay, this is what we at the Department of Health need to do. But I think thinking through, okay, who are our key partners? How can we leverage the Department of Mental Health? How can we leverage the Department of Education? How can we leverage the resources that are available from the Sources of Strength national team? So I think really having just having everything broken down into specific steps helps make the kind of the big feat of implementing this program, hopefully statewide at one point, just more like realistic and doable. And it just kind of reminds me to use my partners, right? To not just want to do all of it by myself, but say, hey, how can this person or this organization help us here or there? So it just really does help us stay on track with
That's
it helped
great.
us to yeah, it helped us to launch the program and get the implementation in place. And now it really has been helping us with this kind of transition period as well.
That's great. Thank you so much. And the responsible party and due date are super important. And like when we use a similar process, even planning a webinar like this one, we get down to, okay, this is one thing that has to be done. Jenny's doing that. And this one, Marie is doing that. And we actually put names, not just like for responsible party. So again, you can use it as, this is we're either we're engaging our partner as a whole or we're asking, you know, Jane from this organization to do
Hmm.
this. And you can get as granular and as detailed as you need to. But thank you so much, Melissa. I think we can go on to the next slide now. I'm really interested in any questions that people have or any discussion on this. I don't see anything in the chat right now, but are there any questions for Melissa or anything else that anybody would like to talk about? And then we have a little bit of an activity on how to use this in your own work. But first, I just wanted to open it up to questions. Well, thank you, Melissa. This was a really great demonstration of how this tool can be useful. And I really hope that all of you who haven't used something like this before will use it, will adapt it, will make it work for you. And so I just wanted to take a few minutes and give people a minute to think about it. How could you use this tool in your work? So first of all, think about your SMART goals. Like what are you trying to do? What do you want to accomplish in the next, think about 30 days, 60 days, or 90 days? What's something that's, that's measurable? Oh, Joanne, yes.
I wanted to highlight that somebody noted that these are living documents, and it really is important to revisit them like on a weekly or monthly basis and take note of what is done and what is progressing and what barriers you're coming across and how to address your barriers and how to address your successes and celebrate your successes and be able to mark off what's done and celebrate that. And it's really makes you feel good to mark the things that are done and mark those cycles and say, okay, we're done this, what's next? So it's a living document. Don't just let it gather dust and say, oh yeah, we wrote this a year ago, we should check in on it. You know, mark a time on your calendar where you go check on your plan so that you don't just write it and then forget about it.
That is a really important point. Thank you for saying that. I think Melissa, as you've been talking, that's definitely what you've been doing is you've been really making use of it all the time. And it does feel really good to say, oh, I aim to do it by this date, and I did do it by this date. So I'm checking that off. And then to say, well, I checked off three things, one of them didn't happen. And then that's the information that you have that's going to help you, right? To say, so why was it that I got these three things done, but this fourth one didn't get finished. So what were the barriers? What were the things that made it hard to happen to make it happen? And then when I make my next plan for my next 30 days, what am I going to do differently? Maybe the person who was responsible for it has 16 new projects and doesn't have time for that anymore. Okay, well then maybe we should assign it to someone else. Or maybe the way that we've been doing it just hasn't been realistic. Or maybe there's a block somewhere. So like in our next plan, we're going to kind of take a different route. So I think that's a really good point, Joanne, that it's a living document. It's good to check things off, and then it's good to see what you haven't been able to check off and then use that as a learning point so you can move
And
on.
sometimes you have to select items that you're going to discontinue because it's just not feasible because you had it in your plan. It's like, well, this is just going to be discontinued. It's just so unfeasible to go forward with this. We're going to move it down to the way bottom of the list. Maybe we'll revisit it later, but it's just not feasible. It's discontinued, and it's okay to move it off the list or put it down to revisit later. Some people call it a parking lot. You don't have to get everything done all the time. Sometimes you lose funding for something, but put it down in the discontinued list. You don't have to keep everything on your list all the time because we have plenty to do. So sometimes it's met, sometimes it's not met, sometimes it's in progress, and sometimes it's discontinued, and that's okay because we have a lot to do.
Right. And also because you're learning about what's important and what's feasible as you move along. Totally. So thank you again for that. I still want everybody to be thinking about how you can use this tool in your work. And actually, one of the reasons why I came up with, well, while I thought about using this tool now is because I've done a lot of work with schools. And I know that in bullying prevention, it's the start of the school year, either this month or next month. For suicide self-harm prevention, a lot of things work on a school year cycle as well. Not as much, maybe with teen driver safety, it would as well. So, I mean, I think a lot, not all, but a lot of what we do in our work with around safety with children and youth kind of follow that school cycle. So that's why I thought of like, is there anything that and also, for me, no matter what happens, no matter that my kid is now 25 years old, I always think that the year starts in September. January is meaningless to me. September is the start of the year. So considering that, I always think about, fresh start in September, cool fall breezes. What am I going to do? What's going to be different? What am I going to launch? So that's why I think like, it's a good time to think about, is there anything that you're planning to launch or planning to start over the next couple of months? And then use that as the starting point for doing one of these action plans. Does anyone have anything that they want to share? Any kind of a goal or an activity or a strategy that you think might lend itself to using a 30-day, 60-day, or 90-day action plan? I'll give people just a minute to think about it. And then I will turn it over, I think, to Jenny for the last couple of slides. Is that right? Did I do it right this time? All right. Well, please think about it. Please feel free to share. If you think of something in the next 5 minutes, you're welcome to type it in the chat or just to raise your hand so we can call on you because we really do want to hear from people. But thank you so much, Melissa. Oh, good. We have something. We have Heather raising her hand. Yes, Heather.
Yeah, hi. I also didn't realize that I was off mute the whole time, so I could have just piped up. Related to the work, knowing that suicide prevention is connected with our youth tobacco awareness campaign, and the Department of Education is actively going to be planning the launch of a statewide collaborative between as many of our invested departments, commissions, agencies, and the organization of this collaborative to be able to move forward to have meetings on a potentially quarterly or bi-monthly basis. It's definitely going to need much more hands-on work to get it going. And so we're going to, when we get to the certain organizational point, we'll be inviting Melissa's team to join us because they have a vested interest, and we'd love to share the work that they're doing with others so that we're not, we all know the work that everyone's doing in this space for youth tobacco prevention. So a 30, 60, 90-day plan to launch the collaborative will really help us stay on track and maintain momentum. So I'm looking forward to giving this strategy a
That's
try.
great. That's great. Like to really apply it to something that you know is going to be complicated and you know it's going to have multiple steps and you need to figure out how to break it down. So I'm glad that
Sure.
you're thinking that this tool will be useful to you. That's great.
I've always been a participant, but never organized one myself in collaboration with our other partners. So yeah, I think this is a great idea.
Great.
That's a great
Thank you.
example. I wanted to share another thought that came to mind while Melissa was presenting on thinking about like long-term sustainability and not just like the funding part of sustainability, but the sustainability of institutional knowledge of knowing like what the team has attempted to do in the past in order to get to their goals. So what an awesome way also to like be able to track all of the activities that go into implementing a program and following it up by having these 90-day aims and particularly the way that the Tennessee team has been using the tool as well to be able to track all of the very minute steps and pieces that are necessary in there. Um, and then being able to hand that over to somebody if, there's been a change in staff or show a new staff member, like this is what we've been doing, this is what we've tried in the past, this is where we're going with this. Part of that like internal and external communication of like not just, what's the ultimate end goal, but like how are we getting there within our team.
That's why it's important to keep track of the discontinued or abandoned things and the reason why for future reference. So if there was a political reason or some kind of reason why you could not continue with something, you have a note of it. So if somebody in the future says, hey, let's try this brilliant idea, or you can say, oh, we couldn't do that because the governor disapproved of it, or there was complaints, or the legislator didn't approve of it, or we had, why can't we try this again? It's like, well, we really had a hard time getting that to fly last time. We can try again, but there's going to be a lot of uphill battle with that. So it's really important to keep track of the discontinued items as well.
Totally. And also to have the ideas of if I'm going to do this again, I need to know what not to do and how to do it
Right.
differently. Yeah. So I think Jenny's going to wrap us up today.
Awesome. Such a great conversation. Thank you, everyone. I just wanted to quickly wrap us up and again reiterate what Lauren said at the beginning, that we are right now at the tail end of our recruitment for cohort 3 of the Child Safety Learning Collaborative. And so Maria has posted the link to our CSLC page on the web that you can access more information, access some of the related publications that we have. And if you are interested in joining, then please follow the instructions to request an application link for an online application. And we would welcome you all to join, or we'll connect you with other folks that are already exploring the possibility of joining to help further that opportunity. So in conclusion and wrapping us up, thank you again for joining. There is a brief evaluation link that you can scan. It will also launch at the end. We do value your feedback. It helps us to improve these events. We especially want to hear from you any ideas of topics that would be particularly pertinent to your work. So it helps us to develop our future events. And we encourage you to follow us on social media and sign up for a newsletter to stay in touch with all of the events at CSN. Thank you very much and have a fantastic day.